worked on and have been stewards of the vast traditional territories where Northern Health sites are located in Northern British Columbia. In particular, I would like to acknowledge that the organization of this seminar takes place on the unceded territories of the Lheidli First Nation, where we have the privilege to live, work, research, and learn, and we're grateful for this opportunity. At Northern Health, we're committed to building and nurturing relationships with Indigenous peoples across the North and in British Columbia. We acknowledge their traditional and unceded lands, and we strive to advance towards cultural safety and reconciliation work that should be reflected in reductions of health inequities and targeted efforts to improve health outcomes for all Indigenous communities in British Columbia. Today, our seminar is titled Barriers and Facilitators to Physical Activity in Rural Communities, using the Behavior Change Wheel to identify intervention functions. It's going to be presented by Kirsten Ward, serving as Interim Regional Clinical Practice Lead in the Department of Physiotherapy, and Gloria Fox, Regional Physical Activity Lead, both of them working here at Northern Health. About this presentation, this study examined barriers and facilitators to physical activity in rural British Columbia using the Theoretical Domains Framework and Behavioral Change Wheel. Semi-structured interviews were conducted with 46 adults from remote, small, rural communities, population of 20,000 or below. Questions explore beliefs and lived experiences related to physical activity, and responses were deductively analyzed and mapped to behavioral domains and the COMBI model, which is capability, opportunity, and motivation, who has been tested for changing behavior. Key influences included social support, environmental resources, and belief about health and injury. Findings suggest that intervention should focus on environmental restructuring in collaboration with communities, supported by policies to improve infrastructure and leverage existing facilitators. We'll have about 30 minutes for Kirsten's and Gloria's presentation and ample time for Q&A or discussion. Please include your questions directly in the chat. Without further ado, Kirsten and Gloria, you might begin with your presentation when ready.
Thank you, Marcelo. I'm going to get us started. Hi, everybody. My name's Gloria Fox. As Marcelo mentioned, I'm the physical activity lead for Northern Health. I sit within the Healthy Living and Chronic Disease Prevention team of Population and Public Health. I am just working on getting my presentation, our presentation up. Sorry, Kirsten. And Kirsten will be giving a little bit more information about her position when she starts to speak. And I just want to, you guys are seeing the whole thing right now, aren't you? Not presentation mode.
No, the whole thing, all good.
The whole thing. Okay, let's see if I can change that. This is good practice for me. Kirsten is more used to doing this, so sorry, you guys are my guinea pigs while I get used to
it. Looks good, Gloria. You can't see your speaker notes at all.
Yeah.
Okay, great. Okay, awesome. Thanks, Julia, for the extra thumbs up. All right. So yeah, I want to also acknowledge Kirsten and I are both joining today from Lheidli territory. My position is regional, but this is where I'm based out of. And in my role, which I've been in since late 2016, I've been really privileged to be able to join a number of research projects through partnerships with UNBC. And so this is one of the projects that I've been able to be a part of. So a little bit of background. Kirsten and I are here to present on this project, but we're two of a number of people and organizations that were involved in the project. So this is a collaborative team with representation from UNBC School of Health Sciences, UBC School of Kinesiology and Northern Medical Program, the UBCO School of Exercise and Health Services, Northern Health Population and Public Health, and the Promotion of Wellness in Northern BC, or WIN-BC. Our project was funded through a CIHR Catalyst grant, and our aim was to, as Marcelo mentioned, map the barriers and facilitators of physical activity in rural communities to the Theoretical Domains Framework and Behavior Change Wheel to identify what works, why, and how. So I'm setting the stage a little bit here. So why do we want to focus on physical activity? It's actually linked to many improvements in so many areas. It's often considered to be one of the biggest bang for buck when it comes to health promotion and disease prevention. We actually just had the Participaction Physical Activity Report Card for adults released, I think, last week. And according to that, physical inactivity costs Canada $3.9 billion in avoidable healthcare expenditures each year. And meanwhile, just a 15% relative increase in physical activity among adults in Canada could reduce the costs of treating and managing non-communicable diseases, depression, and absenteeism, saving almost $1 billion per year. So that's one of the reasons why. And we have so many co-benefits that extend from physical and individual health to include healthy communities, environmental health, economic benefits, and so on. And why do we want to focus on rural communities? Well, 20% approximately of Canada's population lives in rural communities. And I would hazard a guess that 20% of health research does not relate to rural communities. So people living in rural communities have a shorter life expectancy. They have higher rates of non-communicable diseases. And we also face unique barriers when it comes to accessing physical activity. Some of those things include, but are not limited to, geographical distance to and from opportunities, lack of available opportunities or lack of knowledge about what's available, and built environment factors, just to name a few. So closing the population health equity gap between urban and rural populations is a priority, but classic health promotion strategies won't have the same effect in a smaller community as it would, or as it might in a larger community. So with that, I'm going to turn it over to Kirsten to provide a little bit more details on the study itself.
Awesome. Thanks, Gloria. Hi, everyone. My name is Kirsten, and as was mentioned, I am currently the clinical practice lead for physiotherapy for Northern Health. So that puts me under the Regional Rehab Service Network. If you haven't heard of it, I'll give you a little push here to maybe look into what that is. But I'm really excited to be here to chat about this study. It was an amazing opportunity to work with a bunch of different places. I had a more of a researcher hat on with this, working with UNBC, but really happy to be able to share it in this capacity with Northern Health as well. So as was mentioned, we did individual semi-structured interviews for this. We did it across 2 regions, the interior and the northern areas of BC. And because of this geographic range, we did do the interviews over Zoom, and we did that over the course of about a year, from June of 21 to March of 22. So we covered different times of year 2, which was really important, as we know that, like Gloria mentioned, things like the environment, weather can have a huge impact anecdotally. So we wanted to make sure we covered everything. We specifically recruited, as was said, from communities of less than 20,000 people. And we did this to kind of stick with the Ministry of Health definition for rural and to make sure that our findings could be consistently applied elsewhere. We ended up with 46 participants, and you can see on this map, or maybe you can't see because it's a little bit small, but we had a pretty good range. We had everything up Fort Nelson, over to Haida Gwaii, over to the Alberta border, all the way down to the US border there, and a bunch in between. So it was really exciting to see this variety in recruitment, as that can often be one of the hardest things with it. We'll go to the next slide there. So after everything was transcribed and reviewed, a couple of us went through preliminary coding and came up with a guide. And this was made with a theoretical domains framework in mind. So if you're not familiar with that framework, this is what we're referring to, where we're looking at behavior and behavior change with the idea that barriers and facilitators can be sorted into these kind of broad buckets. So things like knowledge or skills, emotions, intentions, social influences, and so on. And so we had all of those buckets, and then we sorted those into 3 specific ones, which is the COM-B framework that was mentioned in the intro there. So capability, motivation, and opportunity. And this also is a framework that falls under that behavior change domain. So through this, it was actually a really interesting process mapping everything onto it. And we'll go to the next slide here, which actually has this one is going to be too small to read. That's okay. But this gives an idea of how everything ended up getting sorted. So you can see we've got that really big overarching topic of behavior. And then it's broken down into the COM-B model, so capability, opportunity, and motivation. And then everything is broken up underneath that into the corresponding TDF domains. Within each domain, we then broke it down into barriers and facilitators. And this was particularly interesting because we were able to do both a deductive approach and an inductive approach. So we both looked at the data and saw what it said and allowed the data to build the narrative, as well as looking at it from kind of the top down, looking at it with these frameworks and fitting the pieces into what we knew. So as an example for this, again, I know it's hard to read and you probably can't. That's okay. If you want the bigger figure, we can share that. But under capability, we have the TDF domain of knowledge. And within that, we have barriers of safety and knowledge of the area, and facilitators such as purposeful activities, safety, learning from others, and physical activity knowledge. Now, you might have noticed that I did say safety was both a barrier and a facilitator, and that came down to the context of the data. And we found this really interesting throughout many of the different categories. For this one, if participants knew how to be safe and had what they needed to be safe, such as high-vis vests or ice cleats, things like that, it really facilitated their physical activity. On the other hand of that, if they viewed their environment as unsafe, they didn't have a safe place to walk with maybe no sidewalks or trails, and they didn't want to walk on a busy highway, they were far less likely to partake in their physical activity. So all of this was super context dependent on what was being said. We can go to the next slide. And I've spoken to this a little bit. I've started to touch in on this, but these are some of the biggest findings that we had with this work. So things that were frequently spoken to and emphasized was primarily opportunity as a barrier to physical activity, more specifically environmental context and resources. We also found motivation was there with social and professional role and identity reinforcement. And then on the other side, we found a couple of the biggest facilitators were capability or knowledge, and then social influences and environmental context and resources. Again, under opportunity, that one kind of kept coming back around regardless of which side we were looking at. So for these, the most prominent, again, one for sure was that opportunity category. Every participant spoke to their barriers and facilitators in their environment. Bar none. That was the biggest thing we heard about for sure, whether that was barriers related to weather, wildlife was a big one, a lack of infrastructure, or a lack of safety in their environment, or if that was facilitators, that they had easy access to outdoor activities, or there was a real community culture of being physically active that kind of boosted people up that way. Those were things that we heard again and again and again from folks. On that barrier side with motivation, this was also a really big one where social and professional roles came into this as they prevented people from being able to take time or energy to do physical activity. So whether that was because they were working 2 jobs and trying to manage childcare and trying to keep a home clean and trying to do all of those other things, they had no time, no energy to do any sort of physical activity outside of that. They put everything else first, and then it just didn't happen. Another way that we heard that one spoken to was that if they did have a little bit of time at the end of their day, they had an hour of free time, it was much more likely that they were going to take the time to relax and do something restful versus trying to do that physical activity. They just didn't feel they had the energy, even if they had some of that time. The other one that's tucked under motivation there is that reinforcement. And this kind of went along with that opportunity to relax. So it was often reinforced when people had the opportunity that they didn't necessarily want to feel bad. They didn't want to get sweaty. They didn't want to put more energy into something. They tried to take the opportunity to relax. They sat on their phone. They sat and watched TV, or they were doing things like maybe that bubble bath to try and, do some self-care. So there was some reinforcement with their current patterns that they felt good doing the things that were not physical activity. Last one on this is under that facilitator side for the opportunity. So that social influences was huge. And this one was really noticeable in that culture of what was going on really dictated it. So if people were seeing everybody in their community being active and doing things, they also wanted to. And if they didn't see that, it could also have been a barrier as well. Not noted as much. I think people didn't know what they didn't see, so they didn't notice it as much. And lastly, for that capability for knowledge. So if people didn't know how to be physically active, they didn't know what to do, where to go, they didn't know the benefits of being physically active or the risks of not being physically active. That was also huge. And we heard it spoken to a lot that people, I feel good, I feel physically good, I feel emotionally good, I have all of these benefits. I know I'm going to keep these benefits as I get older in my community. I'm going to be able to live independently. I'm going to be able to look after myself. I'm going to be able to play with my grandkids. They had this knowledge base of why this was good for them and how to do it that really facilitated their activity. All right, Gloria, to the next one. Thank you. So now that we've heard kind of what people were experiencing and what they were expressing to us, what do we do about it? How do we facilitate this? And there are a number of things that we heard that could be helpful and a number of things we were able to kind of pick up on that maybe these are some ideas that could help. The biggest one was that environmental restructuring. And this is the biggest one, both in the frequency and the actual task of this is really big. So doing things like adding trails, adding sidewalks for people to safely get outside and not walking in the middle of a highway because that's where the community is located. So they don't have another option. Things like ensuring there are facilities and keeping them open, keeping them staffed, keeping them low cost. And really allowing that opportunity for people to be physically active. But again, those are really big ones that can be really hard to evoke change in. Another one is social connections. And this one was really important, primarily related to that motivation piece, wherein if they had sufficient social support, this created opportunities for people and this created motivation. Sometimes people referred to it as keeping them accountable, that they had someone that was going to go do this thing. So I had to be there with them. Otherwise, they're going to be calling me and saying, are you okay? What's going on? Why aren't you here? So this was something that really drove it and really allowed people to be able to get physically active. The next one, education, largely is related to increasing that knowledge base and understanding of the importance of physical activity, but also acknowledging how to be physically active. And if this is something that you've never done or never had modeled for you, I think we often can take for granted how difficult it can be to be physically active in a way that feels okay. The next one there, modeling. So this one's a dual one where people want to see physical activity modeled for them. So it was noted by one participant that if they saw a group of other ladies out walking in their community, they were more likely to get out and start walking because, oh, hey, they're doing that. Maybe I should do that too. On the flip side, people also wanted to be good role models. So if they had kids or grandkids, they wanted to be active to instill those habits into their family. And so they wanted to be able to do that. Cultural relevance is a really big one, and Gloria is going to speak a little bit more to this one. So I'm going to put an asterisk on that one and say really important, and we're going to come back to that. But we do know that rural communities have very significant cultures in and of themselves, and each one is different from the next. So this is really big underscored one, but I'm going to let Gloria speak to that. The last one here is that supportive policies. Again, this is a really big one, and this one can be quite difficult to enact or to even imagine sometimes, but things like having supportive childcare so that maybe if, I know the YMCA in Prince George has childcare where you can have your kids playing and supervised and looked after while you do a workout. And things like this would really facilitate it versus getting home from work and having to spend your time looking after your kids and then not having time to yourself until they're in bed. Well, then you have to be quiet and you can't leave the house. So things like that can really make a difference, but it is a very big one that needs to have the right people in the room to get going. And with that, let's go to this caveat of our cultural reference and context.
Thanks, Kirsten. Yeah, so local context is key. Every community is unique and has its own assets and its own needs and its own culture. And in many cases, some communities have multiple cultures within them. So it's definitely one thing that comes up in, I would say, every one of our studies is that the local people, the local knowledge holders are the experts on their own community. And so local partnership and collaboration will be critical to the success of any intervention that's planned. So the other thing that came out of this that was new to me is this APPEASE criteria. So talking about when we think about potential interventions that are evidence-based, you know, the article includes a number of evidence-based interventions that could work in different communities, but this APPEASE criteria really makes it connect to the individual community. So whether it's affordable for each community, as well as for the people within the community. Practicability. So, I mean, something like sidewalks on every street is a great thing, but is it practical for every community? Probably not. So a number of things that need to come into consideration. Effectiveness and cost effectiveness, again, that kind of relates to the affordability piece, but also, you know, in this community, how likely is this particular intervention to be effective for the people who live here? Acceptability. This again really links really strongly to the culture of the community. So if what is being proposed is not something that is generally what community members want to see in their community, then it's likely not going to be acceptable on a wide range, and it's likely not going to be successful. As well, what are the side effects or safety considerations to this intervention? Kirsten talked about whether this has been a huge thing that we have to take into consideration in our northern and rural communities is, you know, one of the things that I really like to promote is active transportation. It's not always realistic depending on the weather, depending on the road conditions, things like that. So things that you might not think about in, you know, in the lower mainland, but it's something that is actually a huge deal here. Safety things as well regarding wildlife. You know, we've heard a number of safety issues in northern and interior rural communities recently. So things that definitely have to be considered, as well as equity. So we want to make sure that any interventions that we do try to enact in communities is going to benefit those that need the assistance the most. We're not just aiming to make things easier for those who are already reaping the benefits of physical activity. We want to make it easier for everybody to be able to reap the benefits. So yeah, so that is what we had as far as local context. If you're interested in digging deeper, our article, even though the study was done in 2021, 2022, our article was actually just released last month. So it's hot off the press. You can access it here on the QR code, and as well, Marcelo has put it in the chat. Thank you, Marcelo. So yeah, if you're interested in learning more, please go ahead and access it. It's not a super long article, and I'm biased because my role is in physical activity, but I think it's quite interesting. So we want to thank you a lot for having us here today and for your attention on this project, and happy to take your questions. I think there's maybe one or two in the chat, and we might have some live as well. So thanks so much.
Thank you, Gloria. Thank you, Kirsten. Yes, great presentation. Yes, we have one question. here in the chat, did facilitators and barriers vary across age ranges, or were they similar across participants' demographics?
Yeah, that's a great question. And maybe I'll kind of jump in to start that one. So I found that this was shockingly similar across the board. So whether that was age demographic, whether that was location, whether that was size of community, we actually found very similar things throughout. Some of the details changed. So someone who was in Fort Nelson, winter looks a lot different than it did in any of the southern interior areas. So that was different. However, it was still a barrier was the weather conditions. So even though the details changed, the overlying themes remained remarkably similar. Perhaps another example is that they wanted to model behaviors. Well, that just changed from kids to grandkids, but the desire to model for family was still kind of that overlying one. So it was really neat. We didn't expect it to stay the same across demographics, but it really did.
I don't know for sure I can't remember the exact age range, but I think the mean was around 40, 45, something like that. And we've done something similar. I've done something similar with another researcher at UNBC with youth. And again, I just want to touch on like the opportunity piece. The opportunity piece, it was huge in this study for adults. It's also showing up huge for youth. So I think, yeah, it is interesting. It's like things might shift a slight bit, but it's overall these factors play a part no matter the age.
Is there a follow-up question, Julia? You have your hand up.
Yeah, I just had it's not really a question, more of a comment. First of all, this is fantastic. I'm excited to read your article. Congratulations on your publication. And thanks for doing this wonderful presentation too. I feel super seen and heard, especially your piece about like preferring to take a bubble bath and exercising after a long day. Like, okay, are you secretly watching me as you do this?
And that's not bad either.
No, not a bad thing, just something to note.
Maybe only like 2 days out of the week instead of every day. But I think a piece too that I thought was really interesting is the social piece. And for me, there's like an interconnection. So I live outside of the city limits, just outside the city limits, but it feels very rural in the bush. And so the social piece I think is really interesting because it's about those social connections and relationship building, but also it can also impact your feeling of safety. Like it's almost like a two for one, because especially in the fall, we have a lot of bull moose on our road, and in the spring there's bears, and so yeah, that social connection, but also it kind of doubles to make you feel a little more safe to go for a walk or a jog if you're feeling very ambitious. Yeah, that's great.
Absolutely. Thanks.
Thank you. Cheryl?
Yeah, like Julia, I'm super excited that this work is being done. Hopefully I can provide like a real world example. Stop me if I can't. But yeah, coming from the Okanagan where like there was hiking galore and there wasn't like too much wildlife. Like you didn't have to worry about bears too much because the trails were always so populated, like so many gyms and like just so many outdoor activities. And then coming back to my hometown of Burns Lake, it's like, winters are like 10 months long. There's no sidewalks. It's really uncomfortable to walk in like heavy duty cleats and not, just do the socioeconomic status here. Not everyone can afford really good winter tires. So it's a risk just walking on the streets. And then with wildlife as well, like bears, because we've had such dry seasons here, there's not a lot of berries and food for bears. So they're a lot more aggressive and they come closer into town. And we've had so many situations of like families walking with their little dogs and the dogs are actually like attacked and don't make it. And then like just from being a nurse in such a small town, our gym is like the size of, I'm trying to think of the equivalent, like the Walmart makeup section, like it's tiny, it's small. And so if I look at the patients who have been very vulnerable with me, like their mental health issues, or maybe I put a catheter in them, I don't think they probably want me working out next to them in the gym. So it's, yeah. And we had this beautiful track here that was like a special kind of pebble. And then the town decided, the village decided to pave it. And they fundraised for years and years and years to pave it so people could like walk with their baby strollers. But it's really hard on the knees. So running, like I don't see people running on it anymore. So yeah, I think it's such a night and day difference. And I'm just so excited that this is being looked at, because it almost doesn't even matter what your socioeconomic background is in terms of activity in like these rural towns. It's like you're all facing the same barriers.
Absolutely. And I don't think you even need to read this. You know what it says already by the sounds of it. You hit a lot of those points, and I think there's even more that we couldn't reach with this, just based on who comes out for research activities as well. And it's an area that so much more can be done into. So I think we're really excited to hopefully add some momentum to this and see more done about the health in rural communities.
Excellent. Thank you, Cheryl. All right. I think Cheryl commented a good segue for I think there was a concept there or word about policy. So my question from the KT perspective lenses is, okay, what's next? What are we doing with these findings? How can we utilize these findings into programming, into decision making? I don't know if you can speak a little bit about that big word of policy, who intervenes into these kinds of big concepts that you refer in the study.
Yeah, really good question. And I think it's unfortunately a hard one to answer. And I think something that we've heard through this work and through some other work as well is that largely it has to be groups at the level of the community, whether that's like local government or local healthcare or whoever that may be. But implementing those changes really need that local lens and that local context versus having something at like a provincial level happening that it simply can't account for the differences in all of these little communities. So I'm not sure that answered it, or if Gloria has a better answer, but I think it's really challenging to pinpoint something specific.
I don't think I have a better answer, but I can add a little bit. So I know, like from a policy side of things, this information is super valuable for me because on our team, we work with our Healthy Communities leads when communities are reviewing their official community plans. And so when those are being redone, this is an excellent opportunity for me to share that these are some of the evidence-based ideas that can help you if you're looking for ways to make your community healthier or, to improve health equity in your community. Here are some ideas. Again, that can't be it alone because the local context is key. So, but the local governments that are reviewing the official community plans should have a better sense of what will work in their own community at that point. So yeah, this also, I mean, we're always also trying to promote some health promotion and counseling amongst like during healthcare visits. And so knowing what these factors are, the barriers and facilitators kind of helps provide a little bit of guidance as far as where to take conversations when there is hopefully capacity to have those conversations.
Okay, thank you. I have another question with regards to maybe the interview or the questionnaire that allow the data to be analyzed. So I'm wondering whether, or if you can speak more about, once we're referring to term physical activity, are we referring to both like sports side of things as well as potentially kind of like just physical activity that someone might have a very active type of work, etc.? Is it combined? And would you foresee that we should disaggregate what are we talking about, if it just literally just being active, or should we also pay attention to specific aspects of like sports or organized sports, etc., within this umbrella of physical activities?
That's a great question. And it is something that came up, I think, during those early conversations of phrasing. So the word exercise has a lot of baggage that can go with it that sometimes physical activity doesn't have, or even vice versa. For this, we specifically went with the broad physical activity of any activity within your day. We didn't define it for participants. We asked kind of more, what does it look like for you? What does it mean for you? Because we didn't want to impose those restrictions on folks. However, I think it would give different answers. And I think the only hesitancy I would have to use the word exercise is that often people don't consider what they do exercise, or it's not organized. So things like fishing, hiking, a lot of walking, a lot of those activities that people were doing, they would not consider that to be formal exercise, or they would not consider that to be organized exercise or sport. So I think we were a little bit concerned that we'd really narrow ourselves down if we used the word exercise. But that's not to say there's not a place for that as well. It just wasn't in this one.
Okay, great. Okay. There's a question here in the chat: were traditional community practices also considered forms of physical activity? And you're responding, Gloria, right?
Yeah. So I mean, Kirsten's saying it as I'm typing it. And I'm so glad that you asked that question, Marcelo, because I think too often people think physical activity is sport or is going to the gym and working out, and it's so much more than that. And one thing that we keep on learning more and more about is that literally all activity counts and all activity matters. And so yeah, I think that there's a lot more work to be done around busting that myth, I guess, or that assumption of what physical activity is. So yeah, definitely traditional community practices would be counted. But yeah, I don't know, and I wasn't part of the interview process, but if people were talking about like if they were counting it or if they weren't. Yeah. So
yeah, it was counted in some cases.
Yeah.
There were a few examples. Not everybody by any means, but there were a couple people that mentioned that within kind of their definition of what physical activity encompassed.
Yeah. Because literally, I mean, there's a scientific definition of, you know, the METs, or like the amount of energy that your body is producing while you're doing activity. And literally anything counts. Cleaning your house counts. So
yes,
you know, so it's we need to kind of say that louder for people in the back, I guess.
Yeah. Nast, I see your hand up.
Sure. No, that I just have a comment, and thank you, Gloria and Christine, for mentioning this. I think for years, I personally struggled with having a dedicated timeline to do physical activities, and specifically going to a gym that I did not like, just because it gave me a lot of like man-made, machine-made feelings. So it is great to see this shift from, you know, having dedicated times, going to the gym, do some physical activity, and only that counts as physical activities. Whereas, like you're mentioning, even, you know, cleaning your house counts, going for a walk with a friend, just talk counts. I mean, that's a great thing to hear. Thank you so much for sharing this.
Thank you so much for sharing. And I think we would have a lot fewer participants if we defined it as going to the gym, because I think a lot of people who are physically active.
Yes.
Absolutely.
Yeah, there's comments here in the chat, etc. Great. Wondering, Kirsten and Gloria, can you speak a little bit about the recruitment? Because sometimes we hear researchers that we would like to better engage with Northern participants, etc. So for the purposes of this study, the paper refers that you use social media posts, emails. Can you speak about that? How effective those methods were in terms of recruiting participants?
Yeah, for sure. So we were very lucky with the study to have folks that had really wide social networks,
Mhm.
so that we had, large email lists and folks that this could get out to. And so that was super helpful. Social media is another avenue that can be used. I always suggest a bit of caution with it because we've seen, unfortunately, these days where you get a lot of bots answering.
Mhm.
And so you can sort through, I think one of our colleagues had like 200 responses and maybe 15 of them were real people.
Mm.
So it can be a lot to sort through. But sometimes it can be really helpful and you can hit a lot of the right people, particularly in smaller communities where maybe Facebook is the way that they communicate with each other about what's going on. And so if you get that right post, you can get the right people seeing it. Under, if you want to add to that, Gloria.
Yeah, just I think yeah, it's kind of a double-edged sword, right? Because if you in smaller communities, if you can have the right person present the opportunity and that person is trusted in the community and respected, then more people might sign on. Also, I mean, there's the inherent limitation of people who are signing up for things that might already be more active. Like they might be interested in this kind of research because they're active already. And so it's difficult to make sure that you have a fully representative sample. But we just have to do our best with
Mhm.
the tools that we have.
Excellent. Yeah, a couple more questions. We would like to encourage more Northern Health colleagues to be part of research studies. So this was a group of 7 people, UNBC faculty, you two, etc. So what's the recommendations or a little bit of tips on how to effectively participate in a group projects that it's composed of people from different organizations, etc.
I might leave this one to Gloria to answer.
That's a good question. I feel like I was really lucky because early days of me starting this role, I was introduced to people who were doing research. So Chelsea Peltier, who is the first author listed here, we have a pretty close working relationship, and so um, yeah, I feel like it's kind of a matter of meeting the right people. But I think there might be, you know, well, I'm taking a stab at the dark here, but finding out topics of interest that
Okay.
that people are working on in at UNBC in particular, or post-secondary
Yeah.
institutions kind of in the area, and just kind of reaching out. But um, networking
Okay.
Yeah.
events.
Yeah.
Yeah, working with Chelsea, I've met another researcher, Taruma Nyanga, and we've started doing work together at UNBC. So, yeah, it's kind of an organic
Yeah.
snowball-y process. Yeah.
Yeah. The only
Good to
thing I'll
hear.
add to that
Yeah.
is sometimes it can be really helpful to do that, cold call, that blind email to just say, hey, I see that you're doing this. I'm also really
Mhm.
interested in this. Like, can we have a coffee? Can we chat about it? Sometimes that curiosity, especially when it's the same topic that someone's excited about, that's the in for a lot of it. So for me, I'm also interested in the chronic pain research, persistent complex pain. I've sent out those random emails to folks and say, hey, like I'm really interested in this. Can we chat about it? And the response is always so enthusiastic
Wow.
because people are excited to talk about it and to get other people excited about it. Gloria and I are thrilled to chat about this because this is
Yeah.
what we love to talk about. And so someone sent me a random email, absolutely. If you sent Gloria a random email, absolutely. We want to chat with you about it. So
Yeah.
never be afraid to reach out.
Excellent. Thanks for the
I think
recommendations.
too,
Yeah.
I'll just
Yeah.
add one thing too, because I think it might sound intimidating off the start. And so, you know, I feel so fortunate to have my name listed here. Signing on to a project doesn't mean that you have to do it all. So it's a team project. And so I think that might be a barrier for some thinking, oh, I don't have time for this. But literally, I mean, it's a teamwork thing. So if you have time to help out where you can and review things and review the interview questionnaire and things like that, it's not like you have to do it all. So I think that's something that's important to remember.
Thank you. Excellent. Julia, do you have a comment or a question?
Yeah, I have I guess a question or maybe it's a comment. Just thinking about over time how factors might change. Like it would be really interesting to carry this research out longitudinally because I'm just thinking about things I put in the chat, like around climate change, wildfires, extreme heat, extreme cold, like the different migration patterns of animals that change because of climate change. And so like really thinking, and I think Cheryl even mentioned it too about, you know, like bear populations and it's, you know, dry and drought and causes them to go in different locations than they normally would. So yeah, just really thinking about some of those climate change factors and maybe the unanticipated consequences or larger consequences of that impact things like physical activity. Not really a question, just a thought.
Well, it would be so interesting to do this, follow this out longitudinally. I think that would be so cool. And for this one in particular, no one really mentioned climate change, but I think that might have just been because COVID overshadowed it. So when people wanted to talk about something, they wanted to talk about the change from COVID.
That makes
versus
sense.
I think now we've seen a lot more of the climate change, the fires, the changes in winters. I think that might take more of a front seat than it did at the time.
Gotcha. Yeah, thanks.
Yeah.
Thank you. Nasrin.
Sorry, I was muted. So yeah, thank you for responding to my question regarding, you know, in which season the study or the data was collected. And you mentioned throughout the year. And I briefly looked at your study. There were, if I'm not mistaken, 49 participants. Were you able to keep and maintain these participants throughout the year, or did the number of participants change, or the group age group changed, or?
Yeah, so it was kind of a one-off with folks. So we did the interview with someone, and then we were kind of on to the next. So that carried throughout. So we didn't keep participants at multiple times throughout the year, although that's another study that would be really interesting to do, would be to talk to the same person at different times of year. But I'll stop myself from a tangent there. That would be really interesting to do, but we didn't. It was different people at different times of year. And I think, 46, 49, something like that throughout 46. The course of a year. 46, yeah.
Perfect. Thank you so much.
For sure.
Great. Celia.
Sorry, I muted again. Again, more around that longitudinal piece, perhaps not from a fully academic perspective, but I'm curious if in your recruitment you included the ability for future contact for other projects. I'm more thinking from my background and perspective. I'm marginally involved in the cycling community in Prince George. And even today, like years of our work, and now the city is soliciting community feedback for inactive transport changes here. And I think there could be a lot of knowledge to share. Like one of the things living rural and remote, having done that before, is you don't know what you don't know. And if we can connect with people who even for the money piece, who've applied for the grants, who could help you with your wording, right? Like if we can work as a larger community.
Absolutely. Yeah. And so we do have with this group, I believe they all signed yes or no to future contact. I think pretty much everybody says yes, that they're quite happy to be contacted in future. But I think that that's a brilliant idea. And I'll let Gloria speak more to it because I know she's got some thoughts there.
Yeah, no, I totally agree with you, Celia, that this would be a really, really good tie-in with that that engagement as well as others down the road. I might see you at the engagement next week. But yeah, I think that it would be worthwhile looking at that list. And Kirsten, I don't have that list, but you might, of who was
Chelsea
involved.
has it.
Chelsea has it. Okay, well,
Yeah.
we can find out about that and make sure that people are aware of the opportunity to take part and yeah, possibly add to projects along the way.
Excellent. All right. So, well, the invitation is for everyone to read the paper. I think it brings quite a useful analysis about our northern realities, as well as food for thought for upcoming research that hopefully both of you are involved, Gloria and Kirsten. This has been quite great to hear from you. We know you're actively engaged in different type of projects and activities, but I just want to say thank you on behalf of the team for presenting today. All the best for upcoming research, which we hope there are many opportunities just around the corner in the next year. And we also would like your feedback on the sessions and the seminars, etc. So I'm including here in the chat the evaluation that hopefully everyone can do it at the end of the session or throughout the day. And this is this is it for today's session. The next one is going to be January, the 4th week of January. Literally coming up January the 22nd on Thursday. And we're always actively inviting more presenters, particularly that bring novel research done and conducted in the North or showing our northern realities. So thank you very much, both of you, Gloria and Kirsten. And we'll see you everyone now in 2026, just around the corner. See you and have a great rest of the day. Bye-bye.
Thank you so much.
Thank you.
Thank you. Bye.